Hi, this is Dr. Jeff, the Rocky Mountain Vet. Insulin, people talk about the price of insulin, and God knows it's high. There's several different insulins on the veterinary market. There's Vetsulin, there's Glargine, those are two of the big ones. And they're going to cost a little bit more than the human insulin, which is NPH, as what I use in dogs, NPH, Humulin NPH. Understand that a few years ago, we made insulin from pork and bovine origin. Because of prions, we can no longer do that, all right, because of mad cow disease and things. So that was eliminated by the FDA. And so now we have genetic human recombinant DNA insulin. NPH is one of those. It works really good. Vetsulin is a veterinary brand, and I believe it's beef origin. It doesn't matter in the end. They're going to be more expensive because they had to go through testing to get them on the market for dogs and cats. In the end, we were using off-label the human insulin for years, and it was dirt cheap, $20 a bottle or whatever, Well, because of mad cow disease, that all changed, and unfortunately, the FDA made the companies go back and test all those insulins to make sure they worked in dogs and cats. They did, but then they also, because they're not going to the humans, they had to go through a whole process. That costs money. And as soon as you do that, even though we've been using them for 20 years, they spent millions of dollars on testing, so that's why those insulins are more expensive. You do have the alternative to go to the human kind, which is quite a bit cheaper now, probably $30 or $40 a bottle, I'm not sure. But I use NPH. I'll start that on people who don't have a lot of money. I'll use that versus the Vetsulin or one of the animal ones. And they work just about as good. I think it's real important you put your animal on chromium, 200 micrograms of chromium, GTH chromium, glucose tolerance factor chromium. That's the one I like. For small dogs, maybe 200 micrograms a day. For a big dog, you might do 200 micrograms twice a day. All right, that will help a little bit. And then I think it's real important your diet. They have a diabetic diet now. That can be pricey, but you can also go to like a high protein, low carb diet. Understand, fat interferes with insulin. Carbohydrates stimulate insulin. You do not want carbohydrates, you do not want fat. You want a protein diet. So, some people say, well, I'm going to feed, table scraps. Well, the problem with meat, table scraps, is a lot of times there's a lot of fat in it. So if you get as much of the fat out as you can, that wouldn't be so bad. But you can use a good quality, grain-free diet, and that's probably going to help a lot if you can't afford the diabetic diet. Unfortunately, there's no way to make diabetes cheap. It's just not possible. I don't do a lot of glucose curves. A lot of doctors like those. I think it's important to do one or two early on where you set in the insulin, and then I go to a different, it's called a fructosamine, and that kind of measures how you've been doing over the last 2 to 4 weeks. And it's a lot more accurate, and from there you can kind of adjust. So I'm a big fan of that because that's just the blood draw, send the animal out. They don't stay with me, they don't get stressed, so that doesn't affect the test quite as much. So there's some advice. I don't know, it's a tough one. I pity anyone that has an animal with diabetes because it's a tough disease. It's not like a human. We just can't ask them, Always have some Karo syrup on hand. If you overdose them, put some Karo syrup on their gums. They pop right out of it. It's amazing. So I always have a bottle of Karo syrup around when I'm starting to work with animals with diabetes. And just understand that, assess your animal. If the peeing goes down, the drinking goes down, that's the biggest reason we see animals for diabetes is they pee and drink a lot. So that's one thing. So, you can assess your animal how they're doing that way without having to take them to a vet every month or every 2 months. I know how expensive that can be in this day and age. Do the best you can, and if you have any more questions, get back with us. This is Dr. Jeff saying thank you.